I'm Tom Bagwell, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to you at home. That's really the topic of this week. Urgent care centers and telemedicine, cost, convenience, and treatment. When is the right call to skip the doctor's office or emergency room? Our guest is Dr. Ajsa Nikolic, Section Chair for Urgent Care for Ochsner. First, some background. Dr. Nikolic is a graduate of the University of Vienna, Austria Medical School. She completed her internship and residency in family medicine at East Jefferson Family Medicine in 2004. She also worked as an emergency medicine physician at North Shore Hospital in Slidell and Thibodeau Regional Medical Center. In 2007, she opened New Orleans Urgent Care in the Warehouse District, where she served as the medical director. And in 2014, she opened her second location in the French Quarter. Dr. Nikolic is board certified in family medicine and urgent care. She is currently serving as medical director of APPS for urgent care and telemedicine for urgent care. And it is our pleasure to welcome Dr. Ajsa Nikolic to Hello Health. Good to have you with us on the program.
Thanks for having me.
Yeah, so you were a big believer in doing medicine in a different way, in telemedicine, pretty early on, right?
I mean, anything that makes my life more convenient, and telemedicine makes it more convenient as a patient and also as a physician because it allows me to connect with my patients when it's convenient for them.
Did you ever think that we would see this day back in medical school or anything else?
You know, when I was in medical school, cell phones first came out. And funny story, somebody told me that one day the cell phone would have my agenda planner on there. It would have GPS so I could find my way around town, maybe a camera, and look at what we have now. We have our phones. I even have the internet on there. I have quick access to medical charts where I can check on what's going on with my patients. It's fantastic.
And pictures of your two 4-year-old twins. I'm sure lots of pictures of that,
Yes.
right? Okay. When did the urgent care boom start and what was behind it?
So the urgent care boom started in the 1970s. And I think behind it was mostly the need for convenience. So emergency room physicians realized that patients didn't all belong in the ER, and they needed a place to go where it was convenient, where they could have an unscheduled visit and see a medical provider and get the care they needed. And really over the last 50 years at this point, we've grown to about 10,000 urgent cares in the nation, which is quite a bit.
Yeah, I think 10, 15 years ago, I'm not even sure I knew what one was, and now there seems to be one anyway in every neighborhood or almost at every corner.
So you're right. The first one was in Kenner, and it was in 2000, I want to say 2001. That was where I also had one of my first jobs out of residency.
Not everybody's gotten the message, right, that not everybody needs to go to the emergency room. So for the underinsured, in many cases, still heading to the emergency room, but the cost of that must be staggering, right?
So just remember that when you walk into the emergency room, you're paying for a much higher cost of care. So there's more services that can
more
be...
infrastructure,
right.
more everything.
So you have the emergency medicine physician, you have the consulting physicians in-house, you have the helicopter pad in the real emergency room, and all that needs to be paid for by the emergency room patient. Whereas in urgent care, you know, we do have some labs, we have x-ray on site, we usually only have one provider, we can't keep you there for prolonged periods of time, we don't have all that extensive testing, and we definitely don't keep you there overnight. So there's a difference in the scope of practice.
There's another real benefit, the wait time, right? And I know Ochsner will, show the wait time on a billboard occasionally, those sorts of things, and you do your best, but the reality is there are people with real issues and real challenges right. where you could be sitting in a waiting room that if you don't have one of those, you could be sitting there for hours, whereas if you walk into an urgent care, you're usually talking about minutes rather than hours.
So the goal in the urgent care is to get you in and out in 45 minutes. And really to be able to understand, are you going to be able to be treated and sent home, or can we start the workup? Do we need to send you to the emergency room? And urgent care is fantastic. It's kind of like a mini Walmart. You've got your x-ray, your quick lab. So if it's not a non-life-threatening emergency, urgent care is fantastic.
Okay, so let's talk about some specific areas that urgent cares would be great for.
So remember, any acute episodic care Some chronic care can also be handled in the urgent care. So let's say you have a congestive heart failure and you feel like you gained a few pounds and you can't get in with your cardiologist. You can come in, we can assess the situation and see, do we need to adjust your medications?
If I'm having a heart attack.
No.
That's right. I'm not going to the urgent care center. No. Right.
We can also handle occupational health. We can handle insured patients, uninsured patients. Like we talked about, the cost is a little bit more palatable for the uninsured patients.
Get a little more specific. Broken arms, cold, think I might have the flu. Drill down a little bit.
So sore throat, earache, cough, congestion, nausea, vomiting, urinary symptoms, sprains, strains, lacerations, abscesses. Off the top of my head, those are probably the most common ones we see.
All right. So tonight we're going to talk about telemedicine and urgent care centers. So how are those two combined?
So right now, telemedicine is very much like an urgent care center. What we can handle over the telemedicine platform, we'd like to, for the convenience of the patient, take care of so that they don't have to come in to be seen. So any medical ailment that you have that we can do, get a diagnosis by speaking with you, doing a perfunctory exam through the video platform, and keep you out of the emergency room, out of the urgent care, maybe stabilize you enough until you can see your physician. That's the point of telemedicine. And urgent care is a good fit because we do that already.
Was part of this in response to looking at it more globally in rural areas where there wasn't an urgent care center, probably still isn't at every corner, and there may not be enough physicians to handle the population?
So if you think about it, we've always done telemedicine. It was just by phone. You know, I would get phone calls. My cousin fell at the soccer field and hurt his ankle, and, you know, what should I do? Now, with the video aspect, it makes it a little bit easier because I can see the patient. I can ask them, can you stand up? Can you walk a few steps? How did you roll it? If you press here, does it hurt? So I can then assess, do I need to get an x-ray? Can I send them to urgent care? Can they wait and see and do conservative treatment for a week and then follow up with their doctor at that point if they can't get in right away?
So if you asked your 4-year-old twins or asked any of my 3 children, what is a house call, they'd have no idea what we're talking about.
None.
But at least in the movies and TV shows, the Dr. Welby, would actually have his little bag and come to the house to see you, right?
It's funny you should say that. That's what I got when I graduated medical school, was a little bag to carry around.
And you haven't used it yet, right? But it was a great gift. But that's really where we've kind of come full circle, right? Mm-hmm. Now it's not the doctor physically isn't walking in, but the doctor can now be in your house too, right?
Virtually.
Walk us through that, yeah.
So now instead of having to make sure your house is nice and clean when the doctor comes in, they come in through a screen virtually to communicate with you and to be able to assess your situation. Now, there's no touch, so as the physician, I can't touch your ankle, but I can instruct you where to touch your ankle to let me know if it hurts. And then I can decide, is this something that's higher risk or lower risk?
August 2018, Ochsner introduced a program called Anywhere Care. So how does it work?
So Anywhere Care is 24/7 urgent care. It's provided through an app called the Anywhere Care app. You go online, you download it onto your phone or onto your laptop. About 8,000 patients have already enrolled. Once you get in, then there's a little waiting room that says urgent care. You click on that. You put in your symptoms, what the reason for your visit is, your past medical history, medications you're taking, allergies, and then you pick the physician or the provider that you want to see, and that provider, then you end up in that provider's waiting room, and then the provider, who's, for instance, me on the other side, says, oh, look, I have a patient in my waiting room. And I open it up, and then we're connected, kind of like FaceTime. We see each other, and we speak to each other, and I go through all the information that you put in there, ask any pertinent questions, and do my history and assessment.
What are the other conveniences? You mentioned you don't have to clean up the house. I know you're half joking there. What are the other conveniences of using something like this rather than having to go see the doctor?
So let's say this happens at 8 o'clock at night. You know, that's a convenience. It's 24/7 with the Anywhere Care app. Let's say you're traveling and you don't know where you are and you don't know how you're going to get to an urgent care, that's the convenience of the Anywhere Care app. So I always look at it as, how has the internet made my life easier? Because I can do things from home and I don't have to get dressed to go do it. I can take care of appointments. I don't have to wait tomorrow morning to call my doctor to get an appointment. I don't know necessarily, is it okay to wait? Is it not okay to wait? So when I get that visit with the provider will tell me, no, I think you need to go now, or they can tell me, sure, put some ice on it and see how you feel in the morning. If it's still hurting, then go ahead and go and get an x-ray.
You touched a little on this earlier, but what are some of the symptoms you're seeing patients for this sort of thing? Who's using the app?
So a lot of the patients that we've seen have had the flu, because we launched in August and flu season's kind of picked up since then.
Good timing.
Good timing. And it's people that just really feel too ill to go into the urgent care. They don't want to sit in the waiting room. They need a doctor's note because, of course, nobody wants to lose their workforce. We've seen a lot of injuries, so sports injuries. We've seen a lot of upper respiratory infections, sore throat, ear pain, abdominal pain, nausea. We've had some rashes as well. A lot of pediatric patients as well. Makes it convenient for the mom who's busy and doesn't want to keep her child out of school.
I'm thinking also that not only the convenience of time, but you're not exposing yourself, if in fact you have the flu or something else, to the other people sitting in the waiting room. I know the last time I was there, I was asked to wear a mask because I thought I might have, right? And it turns out I didn't, but don't want to be wearing a mask.
Yeah, I mean, we used to say that you can walk into the emergency room healthy and walk out sick, so.
Possible. You mentioned earaches and sore throats. How does a provider determine an earache or a sore throat from a virtual visit?
So it's funny you should ask about that, because Ochsner's partnered with a company called TytoCare, and they have peripherals. They have a little otoscope and a little tongue depressor, a stethoscope, and with the otoscope you can look in the ear and the provider can actually see video recordings of what your eardrum looks like, your ear canal looks like. They can see video recordings of what the back of your throat looks like, and they can listen to your heart and lungs. The camera's very specific, so you can look at skin, and it's got a thermometer as well, so you can have a live temperature read.
So more detail. So we're picking out couches for the house, and I'm in the store, and I send my wife pictures with, through Facebook Live or whatever it is of the colors. But you can't look, as you were explaining to me, I can show you what the ear looks like from out here, but I can't look inside the ear.
No.
I can't really see inside the throat with something like that, right? What are the other differences?
So the other differences that help with the Tyto kit is that with the camera that's so highly specified, it magnifies the rashes, so you can look at the rash and it's a little bit clearer picture. I mean, even with my readers on, sometimes I can't see as well, so I don't have to pull out the magnifier to look at the rash, which is nice. And that video is then stored so that you have it for later. You can take a look at what your throat looked like. So let's say you came in to my virtual waiting room and you said, I have a sore throat, and I look at the back of your sore throat and I say, it's not terrible, I don't see any swelling, your tonsils look okay, there's no exudate. I can go through that with you. I've always found that challenging in the urgent care when the patient comes in and says, my ear really hurts, I know I have an ear infection, and I look in there and it's not red, there's no fluid, there's nothing that looks like an ear infection. And then I have to tell the patient, but your ear's not infected. This way we can look at the videos together and I can say, look, you see that air fluid line, you see the redness. It's a great way to interact with the patient and let them be part of the diagnosis. So
convenience is a big thing for you and for your patients. So if you're doing grocery shopping, right, where you go online and you choose what you want, and you go to pick it up and you accidentally get the large avocados instead of the small ones which you ordered, you might be disappointed, but no harm done. You go in and get a misdiagnosis, that could be an issue. So how do we know that the care we're getting virtually is the same care we would get if we were in the doctor's office? So
you're seeing the same providers, the Ochsner providers that you would see at the urgent care, you're seeing on the Anywhere Care app. These are all licensed, credentialed, board-certified providers that have been doing primary care, family medicine, urgent care, internal medicine, pediatrics for years before they start telemedicine. We have a pretty strict onboarding program from an Ochsner
You don't just say,
perspective.
hey, I'm happy to do it too.
Yeah.
Good training.
Right. So the training is there. That's one of the things that helps. The other thing that helps is if you're no better, the next level of care is to go to an urgent care, go see your primary care, or go to the emergency room. And I think that's important as a patient, that if you do a telemedicine visit and you don't notice that you're feeling better, that the next step is to go in and be seen.
Okay. How do we purchase one of these Anywhere kits?
So you can go online to ochsnerstore.com. You can go to any pharmacy, or you can go to the O-Bars at Ochsner, and they have them there.
Okay. We're going to talk about how much they cost in just a moment, but first, the doctors brought along a video with the help of the Ochsner production team. Let's take a look.
When your family is sick, you want all the information you can get. And we know getting to a licensed healthcare provider isn't always easy. That's why Ochsner Anywhere Care is now offering 24/7 on-demand medical exams with the Ochsner Anywhere Care Health Kit, powered by TytoCare. With the Ochsner Anywhere Care Health Kit, you can capture lung and heart sounds, images of your ears, images of your throat and skin, as well as body temperature, and send them to the Ochsner Anywhere Care app. A licensed healthcare provider can review your exams during a live video consult to help diagnose and treat many common conditions, such as ear infections, colds, sore throat, fever, cough, congestion, rashes, and send a prescription to your pharmacy if needed. Get the convenience and peace of mind of an on-demand medical exam anytime, anywhere. The Ochsner Anywhere Care Health Kit, powered by TytoCare. On-demand medical exams with a licensed healthcare provider, all from the comfort of home.
Looks simple enough. And you brought along one of the kits to show us, right?
Yeah, so it's actually kind of nice because you can even travel with it. It's pretty small and lightweight.
It can fit in your medical bag that you got for graduation.
When you open it up, you've got the little camera that also acts as a thermometer. Mm-hmm. And then you can take the different parts and pieces. So we have an otoscope, and you can put the little otoscope cap on there, and it's disposable, or you can wash it in the dishwasher. You attach it to the camera like this, and then you press the button, run the video, and it loads up into your phone app, and then I can look at it.
So your 4-year-old kids a couple of years from now will be able to do this with no problem because they grew up with this.
Absolutely.
What about your 80-year-old parents?
So again, there's online training videos. When you go to the pharmacy to pick it up, they'll work with you to show you how to use it, how to put all the different parts on. It's really simple. There's a charger, you keep it charged. It's very intuitive when you look at the screen. It's got your name as the patient, or if you have any other family members that you're sharing the kit with on there, you can pick which one you want. Once you open the app, it'll teach you everything. It's got a little video training, and it'll make you go through it a couple times so that you can make sure that you're getting the tympanic membrane, that you're getting the back of the throat, that you're hitting the right spots to listen to the lungs and to the heart.
Security is an issue. Is it safe?
It is absolutely HIPAA compliant.
Okay. How much does it cost?
So this is $300 out of pocket.
Okay. Insurance companies typically won't cover the purchase.
You can try and file it with your insurance company. Every
Okay.
insurance company is different. So.
Okay. And what about the cost of a telemedicine visit, and would insurance pick that up?
So the cost is $54 cash, and you can definitely file with your insurance and see if you can get any money back. The beauty of the kit is once you buy it, you get a free visit, a telemedicine visit that's free. When you register the kit on Tyto.com, then you'll get a little voucher.
Okay, very good. So when we talk about right care, right place, what's the difference between an urgent care center and an emergency room? Again, I know you touched on this earlier, but there are significant differences.
There are. Probably the hours of operation. Urgent cares typically are open from 7 a.m. till 7 p.m. with some variation, but not 24 hours.
I've always found that ironic because most emergencies I would think happen after 7 p.m., but that's just my own opinion.
You'd be surprised. I think people try to sleep it off and hope that they'll get better. And then when they wake up in the morning after having been miserable all night, that's when they come in.
I wasn't able to plod through.
Right.
That's right. Yeah.
The emergency room typically has an emergency room physician with other advanced practice providers staffing the emergency room. The emergency room also has, like we said, the consultants in-house. So you have cardiology typically there. You have an ICU, you have a helicopter pad. So there's a lot more, the lab is a little bit more extensive. Diagnostic equipment such as CT, MRI, X-ray are on site. In urgent care, we typically have point of care testing, things that can be done in-house and quickly within 5 to 10 minutes. And we have simple X-rays, so we don't have CTs or MRIs or ultrasounds.
Make us more comfortable with the fact that more and more we're not actually seeing people with the title of doctor or physician, but physician's assistants and others. Because I know you work with these people who work very, very hard to do their job.
So we call them advanced practice providers. The biggest difference between physicians and advanced practice providers is the years of training and the quality of training. So the physician is going to be the most trained provider that you're going to be able to see. 4 years of medical school, 3 years of residency, and then they get their license and you can call them a physician. PAs or physician assistants, they're clinic-based, evidence-based medicine centered around science. They do a 2-year program where they kind of skip through all the different specialties and work under the supervision of a physician. Then you have nurse practitioners who typically went through nursing school, then had some nursing clinical experience, and they're more patient-centered, so they tend to be a lot more caring with the patients. I actually like nurse practitioners, especially in family medicine. They tend to see the whole picture. The nurse practitioner then goes back to school after becoming a nurse and goes to nurse practitioner school, and that's typically 2 years.
And one quick, I'd be remiss if I didn't ask you this question. So before telemedicine, is there any part of you as a physician or provider, in this case both, that worries about the human interaction being there one-on-one in a doctor's office?
So you touched on the fact that I have twins. Well, my parents are from Croatia, and they live in Croatia 6 months out of the year. And the way that my twins stay in touch with my parents is through FaceTime. And so every day we FaceTime with them first thing in the morning for about 10-15 minutes. And that interaction keeps their relationship alive while they're not around, so that when they do show up, it's like they never lost that touch. And I think that telemedicine is going to help the provider keep in touch with more patients without having to step out of the office and go, to rural America to take care of it.
Well, here's another example of Ochsner in the digital realm. Dietitian Molly Kimball explains the Ochsner Eat Fit app in the Molly Kimball Minute.
You're working hard to meet your wellness goals, but it's not always easy. There's a lot of opportunity that we can easily get derailed, get off track. A single restaurant meal, for example, can provide an entire day's worth of sodium and in some cases more than 5 days worth of added sugar. Fortunately, Eat Fit makes it easy, taking the guesswork out of dining healthfully. We have an Eat Fit app that really makes it easy. So we have all of our Eat Fit restaurants listed. When you click on that restaurant, you can actually see all the dishes on there that are Eat Fit. When you click on the dish, you can see the full nutrition facts of it. So whether you're watching your protein, your carbs, your sodium, your sugar, all the numbers are there for your Eat Fit restaurants. We also have a lot of recipes. If you're cooking at home, you're not dining out, we have hundreds of Eat Fit developed and Eat Fit approved recipes for you. We also have brand specific shopping guides. So we don't just tell you to get a whole wheat bread or whole grain crackers, we tell you exactly which one. So download the shopping guide, take a look at those recipes, take a look at those menu items for the restaurants before you head in, and then we also make it easy to connect with your health professional with just the click of a button. You can connect with your dietitians, your physicians, and more, all through the Eat Fit app. And while we started with Eat Fit NOLA here in New Orleans, with the help of Blue Cross Blue Shield Foundation, we've actually expanded Eat Fit statewide. So we now have Eat Fit North Shore, EatFit BR, EatFit Acadiana, EatFit Shreveport, and look for it to expand to even more regions across the state. Our goal with EatFit is to make it so easy, it's like having your own personal dietitian right in your back pocket.
Another 1-minute update from Molly Kimball. So in summary, doctor, what criteria should we use to decide who to see and where to see them for healthcare now?
So remember, if it's something where you're unsure of where to go, telemedicine can definitely help triage where you need to be. Is it something that we can take care of, stabilize you until you're available or able to go somewhere where a provider can put hands on you? If it's something that you feel that your life is at risk, then absolutely you need to go to the emergency room. And that's the way I look at it. Typically with the telehealth visit, if it's something that we deem immediately that you need to be seen, we'll tell you you need to go. In some cases, we'll waive the charge or work with you in terms of making sure that it's not money that you should have not spent.
So a good first step, but not always the last step.
Correct.
Thank you very much. Great to have you with us on the program.
Thank
you
you
for being here.
Thanks for having me.
Dr. Ajsa Nikolic. I want to thank her for the education and information she's provided and for her work in the Ochsner Health System. To make an appointment with any of Ochsner's physicians, including this week's guest, or to register for any of Ochsner's Hello Health seminars, you know they take place almost every week across the greater New Orleans area. You can call Ochsner, the number you see on your screen, or send us an email. We always love to hear from you at hellohealth@ochsner.org. As a reminder, you can rewatch this week's presentation or many of our other Hello Health programs on Ochsner's website at ochsner.org. Just type Hello Health in the search box. Our thanks again to this week's guest. Thanks to Humana and Ochsner for making our program possible. And our final thanks, as always, is to you for your support of this program, Hello Health. I'm Tom Bagwell, and we'll see you next time.